My name is Mark Williamson. I'm a dentist. I've been a dentist since a long time, 1983, so quite a few years. I practiced actively for 31 years. I do not practice dentistry anymore. I decided to go back to school to learn about obstructive sleep apnea and to take it very seriously. I find it interesting that the universe gave me a pretty significant case of severe obstructive sleep apnea with also central apnea, which is a different entity, something that's very difficult to treat without using a CPAP or a BiPAP. I was able to treat myself. I was not able to tolerate the CPAP machine, and just to do that for myself just gave me a strong desire to help other people with the same situation, and there's lots. I love to race cars. These days, as I get older, more drag racing, but I do enjoy that. My other hobbies include hanging out with my granddaughters. My wife and I love doing that. We have a 4-year-old and a 1-year-old, and that's probably the most important thing in our lives. The other thing I like to do is fish. I have fished almost my entire life. I find that calms me. I'd like to just speak about one patient specifically. I'll just use his first name. His name is Jeremy. Jeremy was a patient that I saw 3 months ago. He fell asleep 4 times during a consultation. Honestly, I had to wake him up by tapping him on the knee 4 times just to talk to him. He's at risk of a car crash. He's at risk for himself, but also for other people. I broke a little bit of my rules that day, and I took impressions that day on this patient. He is CPAP intolerant. I could not let him walk out the door with a clear conscience. So we made him an oral appliance. I saw him yesterday. He is wide awake. He said he was in conferences all day 2 days ago. He said he was the only person that stayed awake during the entire day of conferences at work. So it has changed his life. I hear that a lot. It gives me a huge passion to keep doing this.